At the time of this video, America is experiencing another medicine shortage, and this time the kids are being hit the most. This is a quick video on how you can be prepared during this cold and flu season, Kid Edition. I am Nurse Fancy, but I am not your nurse. All information used in this video is for educational purposes only. I always advise you to speak and seek information from your primary care physician. I hate to be the bearer of bad news, but it may not be a bad idea to start wearing your mask again. It's certainly not required, and you don't have to do it. I'm just thinking that so that you can protect yourself and others, it may be a good idea. RSV is very common. It's an upper respiratory infection, and it is just like the cold. You'll see many of the same symptoms, and it's very hard to tell them apart. The reason that it is such an issue this season is because of that special season we had last year when the kids didn't go outside. They weren't exposed to a lot of things, so their immune system is not built up as it would have been in prior seasons. The cold and flu are very similar, except the flu is a virus. They both have the same symptoms, except the flu symptoms will last longer and be harsher. The flu is usually accompanied by a fever. With the increase in flu, RSV, and the COVID rates this season, it's the reason why they are calling it the tripledemic. What you want to do is treat the symptoms and stop the spread. That would include isolating the sick child or children as much as possible. And you also want to be diligent in your hand washing and your hygiene at this time. Make sure that you are super clean all surfaces. For a sore throat, you would like to use a salt water gargle. You can use cough drops, and for the salt water gargle, you just put some warm water in a glass and put some salt in it. Gargle with that, and that should soothe your throat and take down some of the inflammation. If your child is having problems swallowing because their throat is so sore, what you want to do is try popsicles, Gatorade, and ice cream. You got to get something down. I know it may be more sugar than you hoped for or intended, but sometimes you have to cheat. For stuffy and runny noses, humidifiers are excellent. You can also use those vapor wall plugs. Essential oils, especially eucalyptus and peppermint, are great for opening up your nasal passages and helping you to breathe better. An old remedy would be to rub a child down with onion, and it does work. We can never forget about the chicken noodle soup, but here I wanted to introduce you to a lot of spices that you already have in your kitchen that are great for the cold and flu season. Onions will keep the lungs open, and that's why you cry when you cut them. Sage is an antiseptic. Thyme is an expectorant. Honey is an antibacterial. Oh, be sure, never give honey to a child under 1. Never give honey to a child under 1. And you want to always use raw honey. Lemon, it is great to reduce the strength and the length of the symptoms, and it is very high in vitamin C, so it always is a good contender. Warm baths, not cold. You got to make sure that they're warm. If you put a child in a cold bath, it will shock their system. They'll get shakes and tremors, and we do not want that. We always want to do warm. When you get a kid to take a warm shower, it will also help open up the sinus and the respiratory tract. Fatigue or being just tired is just part of it. It shouldn't last any more than, I'd say, 3 to 5 days, so allow plenty of rest. If your child happens to get a fever and you are unable to control it, if it's been 24 hours and it is over 100, 100.4, or 100.1, 3, or 4, that's 100 point with a decimal, then you want to go to the doctor. If you cannot get a fever down, then that means that the infection or the illness is probably a bacterial infection and you may need some antibiotics. So you need to reach out to the doctor quickly. If it goes up and it stays up, you can be in danger of seizures. If you are in an area affected by the medication shortage, you can speak to the pharmacy about using an adult formula measured for a child's dose. This is usually done by weight. Here is a chart here. I'm going to also link it in the description. Those dosages work most likely come by the Clark's rule. And the Clark's rule is, if you can't access the chart, you would take the adult dose time 1. Well, the adult dose, the smallest adult dose, say if it was a Tylenol and you take 1 or 2 Tylenols, say the adult dose will be 2 Tylenol divided by, well, times the weight of the child, which would be 50 to 100, whatever it is, then divided by 150. Again, so it's the smallest adult dose times the weight of the child divided by 150. That would be the children's dose. Never give a child aspirin. It could cause a condition called Reye's disease, and this can be fatal. Never give a child aspirin, no matter what. Here are those spices again: onion, ginger, thyme, lemon, sage, honey, and black pepper. Black pepper is great for opening up your nasal passages.